You will see that pop up on your screen. All right, and we are going to get started. So, welcome to everyone from around the state of Massachusetts and from around the country on this momentous day in November. Our event was featured on AARP's Virtual Community Center, so we're thrilled to have people joining us from so many different places around the country today. I am glad that you have joined us and decided to take this important step in your caregiving or care receiving journey by participating in our webinar today. My name is Polly Mendoza, and I'm the Community Outreach and Volunteer Engagement Director at AARP Massachusetts. Today, we will learn about making sense of caregiving costs. This is the first in a 7-part series as part of our November caregiving series that we're offering. These programs are recorded and made available on the AARP Massachusetts YouTube channel, which is where you'll find a lot of other great educational webinars, not only about caregiving, but other important topics like Social Security, fraud, and brain health. This recording and the resources mentioned today will be sent via email after the event. AARP maintains a deep focus on the health, financial security, and personal fulfillment of people 50 and over and their families. And you'll find that reflected in our offerings and resources and in our advocacy. Across Massachusetts and all the way to Capitol Hill, AARP is leading the fight for the issues that matter most to you. We are working to strengthen Medicare, safeguard Social Security benefits, and champion the rights of older Americans. AARP is urging Congress to better support family caregivers, make communities age-friendly, and crack down on fraud. Thanks to our millions of members, we are winning the fight. In a historic victory, AARP led the charge for a new Medicare prescription drug reform. Starting this January 1st, a new $2,000 cap on prescription drug costs will take effect, saving Medicare enrollees who reach the cap on average $1,100 per year. Additionally, for the first time, Medicare will have the authority to negotiate lower prices on select high-cost medications, an enormous step towards forward for affordable health care. This is all great news for older Americans. You will want to bookmark your local AARP state page where we post about all of our local events, our advocacy wins, and our calls to action. We also have our local caregiving website, which I'll post in the chat for you and send to everybody after the webinar as well. Now I would like to introduce our guest speaker, Renee Senes. Renee joins us as a volunteer with the Massachusetts AARP Speakers Bureau. She is a frequent lecturer on planning for retirement, managing finances, and Social Security with over 25 years of experience in the financial planning and investment field. She is also a certified divorce financial analyst, CDFA, and the owner of Divorce Financial Sense, LLC. Renee is the author of 2 books, Money and Divorce, Costly Mistakes You Don't Want to Make, as well as Money and the Gray Divorce, Financial Challenges of Divorce Later in Life. As you think of questions you want to ask Renee today, please place them in the Q&A section on the Zoom feature, and we will get to as many of the questions as we can in this hour. After today and within 3 business days, the recording will be sent to you along with a brief survey that we hope you will fill out. And again, all of the resources will be sent to you as well. All right, now over to you, Renee.
Thank you, Polly, and welcome to everybody for our presentation on the AARP Workbook for Family Caregivers. As you know, caring for a loved one isn't always easy. So in this session, we're going to introduce some of the essential information caregivers need to manage the complex responsibilities of caregiving more easily. It is our hope that it will be educational and informative, and that you'll leave here today with more confidence in making your own plans, as well as a better understanding of how to plan for your care recipient. Next slide, please. Please keep in mind that this presentation is intended to provide general guidance, not specific legal or financial advice. Your individual circumstances may differ and should be taken into consideration before acting. I cannot provide specific advice or recommendations, but hopefully the information we cover today will help you make informed decisions about your financial future. Be sure to consult a professional for advice regarding your personal situation. Now, let's get started. Next slide, please. Being a caregiver is a labor of love that comes with a lot of responsibilities. While it's hard to put a price on caring, it also comes with some real out of pocket costs. You may be picking up groceries, helping with housework, making trips to the doctor or pharmacy. All the little things add up. Having a clear picture of what's involved, whether it's your care recipient's health, housing, or finances, will let you plan ahead and make the juggling act a little bit easier. That's why AARP has developed the Financial Workbook for Family Caregivers. This workbook is designed to help you focus on the financial aspects of your caregiving journey. We hope that these tools will help you feel prepared and to minimize the stress that making financial decisions can cause. And note, we'll use the term care recipient and loved one interchangeably throughout the presentation, because of course both terms accurately describe the loved one for whom you are providing care. Next slide, please. In this session, we'll review how to use the financial workbook. We'll talk about how to incorporate practical financial tips into your caregiving, and we'll add resources to assist you with your caregiving. So please, before we begin, a few ground rules. Remember to keep your microphone on mute, and also remember that this is a public forum, so please do not share personally identifying information. As Polly mentioned, use the Q&A to ask questions, and this is a judgment-free zone. Next slide, please. Did you know that family caregivers are thought of as an invisible army? But without adequate support, they remain vulnerable to financial and job related hardships, as well as emotional stress. So let's look at some of the out of pocket costs that are associated with caregiving. AARP estimates that family caregivers spend an average of $7,242 on caregiving expenses, such as transportation and home modifications. Next slide, please. According to AARP's caregiving report, caregivers in the US spend an estimated 48 million according to AARP's report, Caregiving in the US, an estimated 48 million family caregivers in the United States provide 34 billion hours of unpaid care to adults' loved ones. Next slide, please. So what does that all mean? It all adds up to $470 billion in unpaid care. Where do those costs come from? Next slide, please. More than 3 out of 4 caregivers incurred some or all of these out-of-pocket expenses. Why did family caregivers incur these? Love, yes, but also because professional care costs more. In 2024, Genworth, a company that sells long-term care insurance, estimated the average monthly cost for homemaker services, things like light housekeeping, meal preparation, and running errands, at more than $7,000. The cost for home health aide, someone with medical training who can assist with bathing or more personal needs, were about $400 more a month, adding up to more than $80,000 a year. Home care in Boston ranges from $37 per hour to $39 per hour. Assisted living averages $6,750 per month or $81,000 a year. Nursing home care is $465 to $500 a day or over $170,000 a year. So, strictly from a financial perspective, it's more cost effective to provide care for a loved one yourself rather than hiring a professional. As we go through this presentation today, you'll hear stories about my mom and her wonderful caregiver, Felicia. Mom and Felicia both lived in Florida, and we were very, very fortunate to have Felicia provide in home health care services for my mom at a very, very reasonable cost. Next slide, please. These costs do have their consequences. Many caregivers dip into their own retirement savings to help pay caregiving costs. Many spend less on their own health care in order to pay these costs, and more than a third cut back on personal spending to get the extra money they need to pay for their loved ones' costs. Next slide, please. About 3 in 5 caregivers, almost 24 million people, have a paying job in addition to their responsibilities as a caregiver. More than half of family caregivers have to take time off from their main job, reduce hours at work, or even quit their jobs altogether to accommodate these responsibilities. This can mean diminished chances for promotions, less job security, fewer employment benefits, reduced money set aside for their own retirement, and lower Social Security benefits for themselves when the time comes. I'd like to read for you an investment news article that came out just about 6 months ago. And this one says how caregiving costs women their retirement security. For most women, caregiving and saving for retirement are on a head on collision. The National Partnership for Women and Families reports that a woman in her 50s who gives up her career for elder care also gives up $324,000 in earnings. Elder caregiver often erupts unexpectedly and is unaccompanied by workplace benefits or structured support for caregivers. The article goes on to say that the retirement of midlife women and caregiving are collateral damage. So that's a pretty strong phrase. The retirements of midlife women and caregiving are collateral damage. This is also true for men who may be providing caregiving for spouses or their elder loved ones, because they also cut back on their ability to contribute to their retirement and their salaries. So important to note that more than a third of the people who are providing caregiving also have jobs and the collateral damage to their own personal retirement. Next slide, please. So, what can you do to safeguard your future and your finances? Plan, plan, and plan. That brings us to the bulk of today's discussion, the financial workbook for family caregivers. The first page of the guide says it all. Dear family caregiver. The guide was designed to help you on your caregiving journey. It was created by AARP and Jessica Allen, an accredited financial advisor, who is a caregiver for her husband who was injured while on active duty in the military. A few points to highlight here. First, the cost of caregiving is high, so please take note of our piggy bank symbol throughout the guide. We added those in so we could specifically point out some tips that could assist you while caregiving. Second, every caregiving journey is unique. There is no one size fits all. Your journey is yours, and there are no right answers, just your answers. You may be able to finish this guide in a day. It may take several days. It may take months. Whatever works for you is what works best. The presentation will simply hit on the highlights in the hopes of helping you complete the guide at your own pace. Finally, and this is obviously a sensitive subject, we all know that caregiving can be stressful, especially over long periods of time. So please remember it's just as important to take care of yourself, both your physical and your mental health, as it is important to look after your loved ones. Please do this for yourself and the person that you're caring for, and for all the people that care about you. Next slide, please. Today, we're going to take time to provide financial tips within 4 categories: health, housing, money, and the future. I'll stop at the end of each section for questions, so please remember to put your questions in the Q&A section. And as we've said, personal finance is called personal for a reason. There's no one size fits all solution. This guide is designed to help you prepare your caregiver financial life in more specific detail. After you complete the guide, it can be a key resource to equip someone to step in and to assist your caregiver recipient in the event of your absence. Also, we strongly suggest you seek assistance from professionals. For example, once you complete your power of attorney, will, and burial plans, you should seek the guidance of an attorney. Once you list all of your debts, perhaps you should also seek an accredited financial counselor to help you create a debt management plan. The guide is designed to help you through this process, not to replace trusted financial advice. Next slide, please. First, let's walk through the health section of the guide, where we're going to begin documenting plans for the health care of your loved ones. We'll cover a wide range of topics, including health, sickness, and even death. These topics can be very difficult to discuss, but it's vital to make the right plans for yourself and for those you provide care for. Before you begin filling out each section, you'll want to make the time to gather the key information that will help you to complete it. For example, before completing the health section, you'll want to collect all of the information about your care recipients' doctors, hospitals, and pharmacies. Next slide. Let's start with your healthcare plan. This section begins on page 5 of the guide, and you'll want to answer some very important questions about the health care of your loved ones. First, who does your care recipient receive care from? Do they use Medicare? If they're a veteran, what about the VA? What about private insurance? There are so many possibilities for health care coverage. Make sure you take the time to understand not only who the insurer is, but to learn about their caps, copays, deductibles, and perhaps most importantly, coverage. On the next page of the guide, you'll list health issues, medications, and accommodations. This page can be extremely helpful at any and all doctor's appointments and hospital visits. Emergency contacts are a must for any caregiver. Who can step in for you with little notice? Hopefully, you have more than one person who can jump in. What other details can you add to this page to help medical staff with your care recipient? Does your care recipient have allergies that the medical staff need to be aware of? Do they have difficulty hearing or seeing? Do they live with memory loss or dementia? If you filled in the accommodations area above, add these details to the last area as well. Next slide, please. As a caregiver, oftentimes you may feel alone, but you're not. Make caregiving a team sport. In this section, you'll document all the necessary contact information, such as names, addresses, phone numbers, email address, and websites. Your care recipient's care team should know you and consider you, the caregiver, as one of the most valuable team players. Caregivers can provide medical professions with crucial information that can make a big difference in treatment. And caregivers can often provide details that the care recipient forgot or perhaps didn't notice. You might also want to check if your state or the state where your loved one resides and gets medical care has passed a version of the CARE Act. The CARE Act makes sure that caregivers are recognized when their loved ones go to the hospital, are notified when the patient will be released, and given the instructions they need for continued care once the loved one returns home. You can even go to aarp.org/wallet cards to download your free CARE Act wallet card for yourself and one for your loved ones. The cards contain information on the CARE Act in your state. Fold the cards, wrap each around your insurance card, and place them in your wallet. Next slide, please. Think about other members of your care team. Do health aides visit your home? Do you have a secondary caregiver that steps in for you so you can take a short break or simply run to the grocery store? Who can step in with short notice? Are you a member of a church or a community-based club? Could a member of one of those organizations assist you? Do you have someone to chat with from time to time about the stresses of being a caregiver? You can list any and all of those people in this section of the guide. We'll provide you with information on some resources that can assist you later in the presentation, but I'd like to mention two things that can really help when you do need a break. One of these is respite care. Respite care is a short break from regular caregiving duties. As we've said, caring for a loved one is stressful and it can have real impact on your physical and mental health. A 2015 National Caregiving Survey by AARP said that 85% of caregivers would find respite care very helpful. Sadly, access to respite care is limited by location, income, and the health condition of your loved ones. One of the links we'll give you later will contain information that might help you provide respite care in your area. Adult daycare programs can provide caregivers with a needed break while giving older adults a chance to socialize. This can help to remedy the isolation and loneliness that many experience. The programs they provide and the costs associated with them can vary, but your local area agency on aging or council on aging can help provide you with information. You'll be able to find your local agency through the links that we will provide for you later on. So I'm going to stop there and see if we have any questions before we move on to the next section, which is going to be our legal section. So Polly, if you would take a look for us.
Yes, of course. So we do have two questions that have come through. The first one is someone is looking for suggestions specifically for solo agers. Any resources?
Suggestions for solo agers that actually came up the other day, and there are many organizations that will step in and provide care. I know of one, I know of two in the Massachusetts area, so I will give those to Polly later on, who can put those into the chat. But for solo agers, I would suggest you reach out to your Council on Aging, ask if they know of anybody, as well as different healthcare organizations who provide that kind of support. Typically, unfortunately, these are things that are paid support.
Thanks, Renee. And then another question was, what do you do to prevent nursing homes from taking hold of loved ones' retirement savings? Are there specific papers to have your loved one sign before they require the care?
So the only instances I would find with nursing homes taking over loved ones' savings would be if you want to become Medicaid as opposed to Medicare eligible, and Medicaid eligibility is a complex subject outside the purview of this presentation. But I would suggest that you speak with an elder law attorney. There is an organization called NALA, the National Academy of Elder Law Attorneys, that should be able to assist you with that. And you can Google them. I believe it's NALA.org.
Great, that is it for questions right now, but please, we welcome more questions if you'd like to put them into the Q&A and we'll answer them at the next section.
Okay, so next slide, please. And let's move on to legal advice. And we are going to talk about powers of attorney. So, a power of attorney is a signed document in which a person appoints someone else to act on their behalf. Powers of attorney are sometimes limited to a particular purpose or period. Other times they're general. And state laws on power of attorneys varies, so you need to know the law of the state where you and your care recipient reside. Also, keep in mind that the guide provides a power of attorney worksheet. It is not a legal power of attorney. Once you have finished the worksheet, you should seek out a legal professional to help you make sure that this document is a legal standing document. Power of attorney must be notarized in order for them to be binding, and they will need to be witnessed. Also, of extreme importance, many financial institutions and medical treatment facilities require their own powers of attorney. You should also know that generalized powers of attorney are not as widely accepted as they have been in the past. And it is at the discretion of every individual financial and medical institution or even business to determine what power of attorney document they will accept. You can have power of attorneys for different financial or healthcare issues, and you can name multiple people to act for you. While many people have one or two others to whom they grant a power of attorney, you can choose to grant power of attorney to whomever you wish, as long as they do not conflict with each other. If they do, the person or service requesting the power of attorney will use the most recent document. Even though they are the same questions, take the time to answer them for both you and for your care recipients separately. Don't make any assumption about who your care recipient may wish to appoint as their power of attorney. Where you keep your power of attorney is also vital. We suggest you keep the original somewhere where it can be protected from fire, theft, flood, or damage. Also, give a copy of the power of attorney to the person you are designating and encourage them to put their copy in a safe place. Some people acquire safe deposit boxes for their bank just for their powers of attorney and other documents, entirely up to you. If your only copy is in the safe deposit box, make sure the designee knows where it is and that they have access to the safe deposit box when the power of attorney is needed. Next slide, please. Will and estate planning is a sensitive subject and it can be very emotional, but it's very important that you make sure to complete this section. These pages can become your voice after your passing. The people reading these pages will be grieving your loss, but the information you provide can actually help them with their grief. If you take the time to list out what you want to have happen, it can take the guesswork out of it for them. And that can greatly reduce stress and grief levels during a very, very difficult time. Just like the power of attorney pages, these questions need to be applied to the caregiver and the care recipient separately. You might be thinking to yourself that you don't have an estate. However, each one of us does have an estate. You might have just a few bank accounts, a pet, some material goods, but guess what? Once you pass, someone has to settle all of these things for you. Take the time to help them know what you want them to do. If you have minor children, you will definitely want to complete the will and/or estate process as soon as possible. Remember, just like the power of attorney, these pages are not binding. While some courts might take it into consideration upon being presented with these completed pages, it's in the best interest of those you leave behind to have an official will or estate plan upon your passing. So consult with a legal professional, please, to get this document completed. Next slide. Again, we're going to delve into a very difficult yet necessary topic, so it's important to make sure your final wishes are known and documented. This will likely to be a tumultuous time for your loved ones, and providing an internment plan can help ensure that your wishes are carried out and will save people from making the wrong decision or trying to figure out what it was you would have liked. We've only included one page in this guide for your care recipient, but there's plenty of space to add your wishes as well. To ensure your end of life plans will be carried out, visit with your funeral home and let your attorney know. They can suggest additional resources to help you complete this process. End of life costs are also important to consider when deciding your burial plans. Do you have enough in savings to cover your burial costs? If not, do you have enough life insurance to cover the costs? Do not leave the expenses to your loved ones. Plan ahead so your loved ones can focus on grieving and settling your affairs. I was very fortunate. My mom passed away 2 years ago, and I was very fortunate that she had the foresight to prepay her funeral. And that really eased the process for me because mom passed away in Florida, where she was living. However, her burial was in New York, where she and I had grown up and where the family, my grandmother, my father, have funeral plots. And truly, I would not have known what to do So it was very, very fortunate for me that mom had prepaid this and that upon her death, I was able to contact the funeral home in Florida and they were able to make all of the arrangements for me, which included transporting mom to New York and connecting me with a funeral home in New York. So they made the process seamless, and the only thing that I had to worry about was getting myself and my children down to New York when the time came. So think about prepaying funerals. Next slide, please. All right. Actually, before we move on to this, I'm going to stop again, Polly, for some questions on powers of attorney, wills, and prepayment and burial plans.
Great. So we did have one that actually came through the chat and it said, are there attorneys that help with all, so no need to go to individual advice?
Attorneys that help with.
It says just, are there attorneys that help with all? So there's no need to go to individual advice. I'm not
Again,
clear.
yeah,
Yeah.
again, I would go to the national, all aspects, okay.
Okay.
Again, I would go to the National Academy of Elder Law Attorneys so that you are looking for somebody who is familiar with wills and trusts and healthcare proxies and power of attorneys, um, and, um what was I going to say? Medicaid planning and nursing homes. So if you Google NAILA and look them up, you will be able to put in your zip code or your area, and they will tell you attorneys that are familiar with all aspects of elder law. That's what you're talking about.
Great. And then we have one in the Q&A that says, do you have opinions on long-term care insurance? I have a whole insurance policy with a long-term care clause, but not sure if it'll be enough.
All right. Well, again, as far as my mom goes, mom had long-term care insurance, and certainly that paid a cost of because we were paying Felicia out of pocket. But the long-term care insurance paid a portion of that, and we paid the difference. So, I can't advise you specifically on whether or not long-term care insurance is right for you, but that would be a great thing to take a look into, determine whether or not it fits, whether or not you have the ability to pay out of pocket for some of these costs, and make sure that you get the help of a financial professional in reading the policy so that you know what the long-term care insurance does and does not cover.
Great. I don't see anything else at this point.
All right, moving on to housing. This section is intended to help you and your loved one get your home in order. If you live separately from your care recipient, you might want to take the time to fill out these pages for yourself as well. Make sure you list due dates, amounts due, where the payment goes, and other vital information. You won't want to miss out or be late on a payment, so be sure you do this for all bills related to your care recipient remaining in their home, such as the mortgage, the rent, the homeowners or the rental insurance, property taxes, and all the household utilities. Note that budget billing is often available from utility companies and should be used when possible. When possible. Companies use different terms for budget billing, but essentially what they do is they'll look at your costs over a year and they'll average it and break it down so that you are paying the same amount every month. So rather than having an inflated heating bill in the winter or an inflated cooling bill in the summer, you make the same payment every month, and each year they would adjust accordingly. Unfortunately, this service is not available from every company, but do contact your utility company to see if they offer it. Also, don't be afraid to ask for discounts with all of the companies involved. There may be military discounts or AARP discounts. Check to see if your state has a tax-free or reduced property tax exclusion for your care recipient. Reduction in property taxes can save you thousands of dollars. Also, remember to ask for discounts on your homeowners or rental insurance. When my mom started to have memory issues, I set up some auto pay for her, but also Felicia set up some auto pay for her, and mom set up some of her own. And what we found was that we had auto pay coming from three different sources. Some auto pay bills, such as like her cable bill and her phone bill, were against one of her credit cards. Some auto pay were coming out of a checking account, and some auto pay were coming out of a different account. And they all had different emails associated with them, as well as different cell phone numbers associated with them. When mom passed away, this became very, very difficult for us to try and sort this out and make sense out of them. So if you are setting up auto pay, my suggestion is that you consolidate. Make sure they're all coming out of one account. They go with one email address and one cell phone number so that you can have that two-step verification in place. Next slide, please. Access to transportation can also be, I think maybe we need the next slide after this one, Polly. There you go. Access to transportation can also be an important factor for your care recipient remaining in their home. Can they still own, operate, and/or drive a vehicle? If so, use these pages to list all of the information you need to own and operate a vehicle in your area. If you're the only driver, use these pages to help fill out the information for yourself. Make sure you check with your local county clerk's office to see if your care recipient is eligible for any discounts or tax exclusions. For example, Purple Heart recipients in the state of Tennessee can receive 2 free license plates. These free plates can save you hundreds of dollars. Many states offer similar types of benefits, and some states require automobile owners to pay property taxes. In Massachusetts, we call these excise taxes on their vehicles. So make sure you know if that's the case in your state and whether or not there are any discounts. Also, ask for discounts on vehicle insurance and public transportation. If you are driving your care recipient's car, please check whether your own insurance covers this or if you would best be served by having you as the primary driver on your care recipient's vehicle. We found out that it was best for us to add Felicia. My mom still had a car at the age of 97. And yes, it went. And yes, it was probably 20 years old, but Felicia drove it. And we found out that it was preferable to add Felicia to my mom's car insurance rather than just having her assume that her own insurance for her own car would cover her. So check all of those issues. Next slide, please. This is a great place to note any special allergies, dietary needs, fish allergies, gluten intolerance, things that may make it helpful if someone is going to be shopping. If there's an animal in the house, a service animal, or just a beloved pet, what are the pet's food tolerances or intolerances? Part of this is also to help you go shopping, but also should you need, well, heaven forbid you become ill, someone needs to step in for you for a day and go grocery shopping. This is a great page for them to be able to know what they need to do, what they should buy or not buy, whether or not there are an EpiPen in the house or any other allergies, so or any other special equipment. So make sure you jot all of that in this section. Next slide, please. Keeping important documents secure is a necessity, and to do that, you might consider getting a home safe. The contents of every safe will look different. We all have different vital documents, but this is a list to help you simply get started. You can always add different types of documents to your own list, and some of the documents that we've listed may not be relevant to you. If you don't have a safe or need to purchase one, make sure it's able to withstand a fire. Also, make sure that it locks and that you put the key in a secure location and you remember where you put it. You might even consider getting a safe with 2 keys so you can keep one in your household if you don't live with your care recipient. Make sure you use that lock. If you have people coming in and out of the house, care providers, healthcare providers, you want to know that all of these documents are secure. Next slide, please. Like the safe contents, you might also want to consider having a secure file cabinet that has a key. Consider placing those in the secure file cabinet to reduce the risk of theft. It was one of the first things that I did for my mom while she was still of sound mind. She and I went to Staples and we bought file folders and hanging file folders, and we started organizing all of her documents. This ultimately became a real help to Felicia because I live in Massachusetts, but Mom and Felicia were in Florida. And as we began exchanging documents and accumulating documents, it became a real help to Felicia in terms of keeping her organized and keeping Mom organized. So, again, make sure you have a separate set of keys and you know where these keys are. Next slide, please. All right, before we move on to money, any questions about what we've talked about so far?
Don't see anything in the Q&A, and I'm checking the chat. I don't see anything new in the chat either, but just as a reminder, please feel free to type in your questions in the Q&A if you have any.
All right, moving on to money. One of the most important responsibilities as a caregiver is planning and managing money, both your own and your care recipients. Home is where most of us spend the majority of time, and it's important to make sure that your home is a low stress environment. Though it's difficult, discussing money doesn't have to be stressful. By taking the time to make your dollars work for you and your care recipient, you can create peace of mind that will help you make your time at home more enjoyable. We're going to discuss budgets, investments, and debt. Next page, please, or next slide, please. The first budget page is for you, the caregiver. If you're married to your care recipient, then you'll probably want to combine your budgets. It's vital that you give every dollar in your home a name. Tracking your dollars actually enables you to control your money. Our page is probably not big enough to list every single dollar, so you can group your expenses into the categories provided. Anything that doesn't fit into the lines exactly can simply be added to the discretionary category. You might want to use an app on your phone. You might like using a pen and paper or an Excel spreadsheet. I actually happen to like using Quicken, which is a financial software that you can purchase and that I find very easy to use to track expenses. The point of all of this is to achieve a zero-based budget. This means that you have $0 left at the end of every month. So we have a college savings line on our form. If you don't need that out, if you don't need college, scratch that out and make it just a savings line. This budget is all about you. AARP offers a free online tool to help you set up your budget using the AARP Home Budget Calculator. Next slide, please. We've added a caregiving budget because we realize that there are specific expenses related to caregiving. As we've noted before, caregivers spend thousands of dollars per year caring for others. Take the time to list out your caregiving expenses separately from the budget that you've put together for your personal finances. We also have a sheet to prepare a budget for your care recipient. Remember, unless your care recipient is your spouse and you've done a combined budget, this budget is different from the one you filled out for yourself. Apply the same thoughts from your budget to your care recipient's budget. If at all possible, involve your care recipient in this budgeting process. Next slide, please. Investments can be tricky. You not only need to have money to invest, but you also need to decide on your risk tolerance toward investing so you can determine where you should spend your money. This is where a financial professional comes in. Spend the time researching investment companies and decide which one is best for you. Make sure you ask about their fees and commissions. Find out if they will be acting as a fiduciary, someone who manages money or assets for another person. It should go without saying, but you'll want to be sure that you're making more money than you're paying out in fees and other costs. The AARP Interview and Advisor tool is a free resource to help you understand a financial advisor's credentials, compensation, and tips on how to get the conversation started around your needs. The tool is available for a smartphone, a tablet, or a computer. One of the things I do want to talk about in this section, and as I mentioned earlier, many investment organizations have their own power of attorney document. And I want to read to you from an article in AARP by Jean Shatsky. It's called When the Best Laid Plans Go Wrong. And it talks about a woman who had power of attorney for her mother, but two financial companies, one of them being Vanguard, refused to acknowledge it. AARP, so it says Mrs. McDermott had a general, durable power of attorney for her mother, so she thought she was all set. Vanguard thought otherwise. We have our own very specific power of attorney paperwork, they said, that is designed to be valid in the face of state by state variations in power of attorney laws. So note that power of attorney roadblocks are common. So advice that I would give you, and I encountered this with my mom. She had investments with UBS, and they had their own power of attorney document. So I would recommend that you contact wherever the custodian, or the wherever your investments are, and wherever your caregiving recipients' investments are. Make sure you get their specific power of attorney documents, contact the banks that you work with as well, and make sure that those documents are completed. Next slide, please. So we've talked about investing and budgeting. Let's talk about debt. So this is going to provide you with a simple template so you can begin organizing debt. Being in debt is not always a bad thing. Most of us make payments for a house, a car, student loans, and credit cards. The only problem with debt is its interest. So the original debt you started out with can easily double or triple if you're not careful. Being debt free can offer some additional financial freedom and peace. And there are numerous ways to eliminate debt, such as organizing your debt from the smallest to the greatest, or organizing it from the lowest interest rate to the highest interest rate. As you knock out debt, you'll feel empowered to attack the next debt that you have. Sometimes we need professional assistance with organizing debt. Your bank may have someone who can assist you, or you can search for accredited financial counselor, also known as an AFC. Many AFCs can even meet with you online or over the phone, so don't be afraid to ask for help. Additional financial strategies customized for your situation can be found with the AARP Money Map. Next slide, please. Let's turn to something that's important to you and to you. Oh, well, sorry, before we get to the future, let's just stop there and see if there are any questions about money.
Let's see. Someone was asking about the guide that we've been referencing, and the link is in the chat. We will also be emailing that to everybody afterwards, but I don't see any new questions at this point.
Okay. So moving on, let's turn to something that's important to you, the loved one you care for, and everyone in your family, the future. What does your future look like and what are your goals? Do you need additional education? Do you have a retirement plan? Do you need to save more for retirement? How might your caregiving responsibilities affect your plans? It's important for you to thoughtfully consider all of these questions and to speak to your care recipient about what they want for their future as well. Use the information from the financial section to evaluate your options. We've included a page for the caregiver as well as for the care recipient. These plans could be similar or they could be vastly different. Next slide, please. Throughout, I've been talking about resources and key terms, so please take some time to check out our resources and key terms pages. We've listed some amazing nonprofit organizations and some governmental agencies that can assist you, as well as some terms you may encounter while acting as a caregiver. We've also got a place where you can jot down some additional notes if it's helpful to you. Next slide, please. And speaking of resources, we did just want to give you a few more before we wrap up. No need to take notes about these now. These will be in the caregiver guide that you are going to receive or are going to be able to download. If you'd like to share it with a friend, it's available online as a PDF version, or you can download it and fill it in right on the screen. Next slide, please. Some more additional resources from AARP. We also have a Caregiving Resource Center and a Family Caregiver Support Line, both in English and Spanish, to help you with tools, tips, and resources. Our Prepare to Care guide is available online as well. It's another fantastic resource that you can use as you approach becoming a caregiver and it comes in several different versions. If you're interested, you're welcome to join AARP Family Caregivers Discussion Group on Facebook to get support during your caregiver journey. You don't need to be a member to log in or to join the group. And finally, and this is obviously a sensitive subject, but we know that caregiving can be stressful, especially over long periods. So we've included the National Suicide Prevention Lifeline. The Lifeline has staff 24 hours a day, 7 days a week, every day of the year, if you are feeling overwhelmed. Last slide, please. So we hope you have enjoyed today's presentation and gotten some resources that you can use. Thank you for being here today. We've reviewed financial tips for caregivers within 4 categories: health, housing, money, and the future. We've also shared several additional resources to support you on your caregiving journey. We hope you will stay connected with AARP and join us for other learning opportunities that you may be interested in. Holly, I'm going to bring this back to you to share upcoming events as well as any additional questions that people may have.
Thank you so much, Renee. And I did want to just share, we do have 6 more in this caregiving series. As we mentioned before, the dates and times are listed on the screen right now. But again, you will be sent this information after today's webinar. And I am going to stop the share so that we can see Renee here. And I will take a peek into the Q&A in the chat and see if there are any more questions that we haven't answered yet. But Renee, I first want to thank you so much for all this information.
My
I
pleasure.
Yeah, I'm a caregiver as well, and every time I hear this presentation, I learn so much. So it's very beneficial to everybody, and I know it can be a difficult time to be in. Um, Sounds like Karen says, I have a lot of homework. I agree. There's always homework to do after these. The documents are just not just for Massachusetts. They are for people in other states. Some of the links are specific to Massachusetts, but a lot of them that we're going to provide as well are just general caregiving links that anyone in any state can access. We just have a lot of praise here. Jenny's saying, thank you for this session. It was so informative. Happy to see that so many resources are available, and there are really just so many out there to get started in your caregiving journey, and people are looking forward to getting the packets and the links. So I don't see any specific questions, just checking the Q&A. I think we're all set. Just lots of accolades, thank yous.
Well,
Uh,
thank you all for joining us and for acting as caregivers. Your families and loved ones are very fortunate to have you.
Thanks, everybody. Have a great afternoon. Thank you, Renee.
Thank you. Bye bye.
Bye, everybody.